In this video, I'm going to be sharing with you everything you need to know about these two popular erectile dysfunction treatments to get the most out of them. We're going to be discussing Sildenafil, which is commonly known as Viagra, and also Tadalafil, which is commonly known as Cialis. So let's dive straight into tip number one. How do you take these erectile dysfunction treatments for the best effect? So let's begin with Sildenafil, commonly known as Viagra. You want to take it 30 minutes before anticipated sexual activity. Remember, always take Sildenafil or Viagra on an empty stomach, okay? That way it's going to work the best. And also remember, timing is pretty key with this Sildenafil because it only lasts about 4 hours. Tadalafil, also known as Cialis, again, this should be taken 30 minutes before anticipated sexual activity. You can take it with or without food. Doesn't really make a big difference for Tadalafil. However, it can last up to 36 hours for some people, so bear that in mind. Also, for those who might be a bit more spontaneous, there is a low dose Tadalafil option that you take one daily. Straight on to tip number two, let's discuss some important food and drug interactions when it comes to erectile dysfunction treatment. So let's begin with alcohol. Firstly, alcohol is a natural depressant, okay? So if you have erectile dysfunction, it's gonna make things worse. Secondly, it can lower your blood pressure. So when taken in combination with erectile dysfunction medication, it can cause dizziness and fainting, so it should be avoided at all costs. Next up, let's talk about grapefruit. It needs to be avoided, so both the fruit and in juice form, please avoid if you're taking erectile dysfunction medication. Basically what it does is it increases the level of the erectile dysfunction medication and it can cause very serious side effects. Next up, I want to discuss heavy meals. This is particularly important for Sildenafil, otherwise known as Viagra. Avoid taking it with heavy fatty meals, okay? This can really reduce its effectiveness, so please do bear that in mind. And remember, it will vary from person to person in terms of how different medicines interact with them and what they interact with, so always do speak to your medical provider. Moving straight on to tip number three, firstly let's talk about some crucial warnings. You should never mix erectile dysfunction medication with another medication known as nitrates. Nitrates are usually given for chest pain, okay, and cardiovascular issues. The reason being is they can both cause a dangerous drop in your blood pressure, which can cause fainting and a load of other issues as well. Now in terms of serious side effects, there's two that I really want to tell you about, but do read the information leaflet that comes with the medication to get the full list of side effects. But the first serious side effect I want to tell you about is something called priapism. This is a prolonged erection lasting more than 3 hours. If this happens, you need to seek urgent medical advice because it is very serious if it's not treated. The second serious side effect, it's rare, but again, if it happens, seek urgent medical advice, and that is any hearing loss. So tip number four, Tadalafil or Sildenafil, which one should you have, okay? This really is a decision you need to make with your medical provider, so you're fully informed, it can make the best decision that works best for you. However, generally speaking, if you have something known as benign prostatic hyperplasia, we call it BPH for short, and erectile dysfunction, generally speaking, Tadalafil, a daily dose Tadalafil, low dose daily dose, is the preferred option for those patients. Now for general erectile dysfunction, both Sildenafil, so Viagra, and Tadalafil, so Cialis, are effective, okay? The most important thing is you try them under medical supervision, so under your medical provider. In terms of myself as a medical provider prescribing medication for patients on a daily basis, you notice that some medicines just work better for some people, and for some other people, maybe that medication just won't be as effective for them either. So it really is a bit of trial and error that you need to involve your medical provider with in finding out which one works better for you. That's the most important thing. Tip 5, common side effects. Please do read the information leaflet for the full list. But in terms of common side effects, both Sildenafil and Tadalafil commonly can cause headache, flushing, and nasal congestion. Sildenafil might also cause blue/green vision changes, also nosebleeds, and Tadalafil can sometimes cause muscle ache. But again, read full information leaflet and speak to your medical provider if you're having any of them. Now, if you're wanting more information or treatment options for a particular medical condition, then let me tell you about Dr. Fox. Dr. Fox are very good friends of the channel. They're an online doctor and pharmacy ready to help with over 30 different medical conditions. And if you want to learn more about their services, I will leave a link in the description below. Dr. Fox, thank you for being our trusted sponsor. Moving straight on to tip number 6, when it comes to effectiveness, both Sildenafil and Tadalafil are very effective. Some people and their partners do prefer Tadalafil over Sildenafil, mainly because it's a bit easier to take and its longer duration of action. But the most important thing is you need to look at your own lifestyle, okay, and see which one works better for yourself, and of course involve your medical provider in that decision. As always, I hope these tips were helpful, and sending Awesome vibes.